Hi, I'm Diane Dayton, and welcome to Mental Health Now, community education, and it's brought to you by Mental Health of America of Lancaster County. And with us right now, we have Executive Director Kim McDevitt. Thank you for being here.
Thanks for having us, Diane.
Yeah, and we've got some important topics to talk about. Today we're going to talk about crisis intervention and 988. And tell us who we have with us.
So we have Rebecca Sangrey, and she's the Director of Crisis Intervention of Lancaster County BHDS.
Okay, so what does the BHDS stand for? Just so we all know.
It stands for Behavioral Health and Developmental Services.
Okay, so first of all, really, what is crisis intervention?
So crisis intervention is kind of a broad term. Really, it's defined by the individual. So our goal within crisis intervention is to provide support to individuals who are experiencing a mental health emergency. We don't define that. Everybody decides what is a mental health emergency for them. But some examples, individuals who are suffering and experiencing an increase in depression, anxiety attacks, symptoms associated with a traumatic experience or event. Maybe something's happened in their life and they need to process that and talk through with someone. So crisis is really defined by the individual, not by us.
Okay, now that totally makes sense to me too. And it can go from here to here.
Exactly.
And it can change too,
Absolutely.
right?
Absolutely. From call to call, when we get the calls in, we're always hearing different experiences and working through those issues and what the individual is calling about. And from day to day, it can change for a person. Okay. So it's not a stagnant situation.
So I guess to try to figure out when we need to call crisis, when do we really need to do that?
Well, I think that crisis, again, is defined by the person. So when are you experiencing thoughts perhaps of hurting yourself?
Okay.
Having suicidal thoughts, having thoughts of self-injury. Mm-hmm. When do you need to talk to someone to process through something because you're seeing an increase in your mental health symptoms? Do you need guidance with how to access services? So really, there's a lot of reasons we get calls, and the staff at Crisis are prepared to answer those calls and to try and help in any way we can.
Okay.
And and I believe that Crisis, many folks that are calling on behalf of a loved one,
Yes.
also call Crisis, right?
Yes, absolutely.
So yeah.
So we can do that. So if we have a family member or a close friend or someone that we see that might need help, we can go ahead and do that.
Absolutely. So our crisis intervention services is open 24/7. So there is always someone available to answer that phone. Yeah. And that is through our local crisis line that serves all of Lancaster County, which is 717-394-2631. You can call there anytime and someone will be available to talk to you and help you with that situation, whether it's for a loved one or for yourself.
Sure. So I guess one thing that might be going through some people's heads, well, if we do this, will the police become involved with this?
Right. No, not typically.
Okay.
It's pretty unusual for us to have the police become involved. Generally, it's because there's a serious imminent risk, meaning someone has voiced and acted upon a suicidal thought. And so the concern is then we need to get them safe. Mm-hmm. And in that process, there's something that's called a 302 in Pennsylvania, which is an involuntary commitment.
Okay.
Meaning an individual, a loved one, a professional, someone who has a concern for an individual due to imminent risk, a danger to themselves or somebody else, can petition someone. And what that means is there's a statement that Crisis facilitates, and then it's reviewed by a mental health delegate. And if that petition is upheld, that's typically when the police become involved because they're who have to serve that petition. Mm-hmm. Crisis doesn't serve the petition, the police do. Okay. And that's a Pennsylvania law.
Okay.
So.
Yeah, and we receive a lot of calls at MHA, and we refer them to Crisis when we feel it's appropriate to do so.
Absolutely.
But people call in with a lot of fear because they don't know how the system works, or they hear that the police might be involved. So it's important to understand the process
Right.
and the supports that are available.
And our goal is to not have the police involved. We
Oh,
want the
absolutely,
least
right.
restrictive intervention possible. And so, our goal is to provide the supports without getting anyone else involved. And generally that's what happens. The vast majority of our calls do not involve police.
Okay.
We also get calls from law enforcement.
Oh, do you? Okay.
So perhaps they've been dispatched to a call through 911 because a family's called 911. They may call and say, this really isn't a criminal matter, and ask us to come out and outreach and meet with the family and the individual. So we definitely work to collaborate with the local law enforcement jurisdictions to try and provide support when they have somebody that is in a mental health crisis and needs that support.
It's really about working together, isn't it?
Absolutely. It is about working together. And a lot has happened around emergency response because everyone is now coming to the table
Right.
and everyone has a common goal, and that is to ensure that folks are connected that are in crisis or emergency type situations. So they have to work hand in hand.
Yeah.
Along with the emergency departments,
Right.
the healthcare systems, along with and then it's a continuum of care, right? So it doesn't just stop once the call to crisis intervention. And I have to say, crisis intervention, we work with crisis regularly. We have phone calls going back and forth, and they have an invested team that is really interested in getting people connected and ensuring the safety of consumers in our communities.
Yeah, that's good. So I know you might be hesitant if somebody wants to call in. What do you really expect when you call in? Just take us through that
Sure.
briefly.
So initially when you call in, the call will be answered by a crisis worker. All of our crisis staff have been trained to answer calls and gone through through training for that. And they'll typically ask, what's going on? What's
Okay.
making you call in today? We'll try and gather demographic information if that's needed. However, all of our calls can be confidential. So you don't have to give us your name, your date of birth, your address, any of that information if you don't want
Okay.
to. And we'll talk to the individual. And through that conversation, it helps to guide what our intervention would be. And so that may be, and the vast majority of our calls are handled over the phone.
Okay.
Because it is individuals calling in because they've had a traumatic event or something has happened in their life and they need to talk to someone. They need to process that, talk through the situation. Maybe they've had a fight with a family member and they're feeling really stressed and they don't know how to handle that. So talking about coping skills and how can we help you stay safe? How can we help you come up with a safety plan if that's needed? And through that conversation, that's kind of guides where we go.
Okay.
There are certainly times where we need to go on what we call a mobile outreach, which is when the crisis workers will come to the individual's home
Right.
and meet with them, meet with the family or anybody the individual wants us to.
Right.
We sometimes go to hospitals if we need to meet with individuals there.
Okay.
And when we're doing those, that's really more when the individual has maybe asked us to come out. They
Right.
feel like it's just not, they're not getting what they need over the phone, or there is a concern about suicidality, and we really need to get there, meet with the person face to face, do that assessment, and see what really needs to happen. Our goal is if someone needs to go to the hospital, we want them to go voluntarily. We want them to make that choice and have control over their own mental health and their own, the steps that go
Yes.
into that. So that's always something that we will always talk to individuals about. Even if we get a call from a family member or a loved one and they have concerns, we'll try and outreach to that individual. Again, unless there's real imminent risk, like the individual has left the house and there's a concern, a true safety concern, we're going to try and reach out to that person and talk to them and about what the options are and what's going on.
Sure. So if you're not sure you're in crisis, it is okay for us to just call, right?
Absolutely.
And then you can help figure out.
Right, because we may not be the right place for you to go, but our goal is to get you connected to the right place.
Absolutely.
So we certainly have people who call us just looking for resources, community supports, the support groups through MHA. So we refer and give out to callers a lot of information regarding community supports. We get calls regarding housing supports and things like that, which will connect them and try and get them to the right place they need to go to.
What's the phone number again?
So the county's direct crisis line is 717-394-2631.
2631. Okay, and what is the phone number and website for Mental Health America of Lancaster County?
So our phone number is 717-397-7461. And our website is mhalancaster.org.
Okay, MHAlancaster.org. Okay, we can get all kinds of information. And in fact, we have more information to give you, more resources, and that's why we're here doing Mental Health Now with Mental Health America of Lancaster County. And stay with us. We'll be right back. Welcome back to Mental Health Now, once again brought to you by Mental Health of America of Lancaster County. And we're here with Kim, we're here with Rebecca. We're talking about crisis intervention and 988. Now, what if you just need somebody to talk to? There's something called Warm Line?
Yes.
Okay.
So Lancaster County has the Warm Line, and their number is 717-945-9976. And that's a program that the county BHDS contracts with Recovery Insight, which is a certified peer specialist program. And they provide support and are available to answer the phone from 2 p.m. to 10 p.m. every day. And essentially a warm line is when you're feeling lonely, when you need to talk to someone, when you're trying to figure out your own mental health recovery and journey. That's what the warm line's for. Not if you're in a mental health crisis,
right? But
you're feeling like you need to talk to someone, and someone's available then to talk with you, and they have lived experience. That's the big thing about the warm line, is because it's staffed by certified peer specialists. They've all been in situations that are very similar to what some of the callers are experiencing. And they have a very different perspective that I think is really valuable when someone's talking to them. So,
what are the hours on that again?
2 p.m. to 10 p.m. And every day, 7 days a week.
Every day, okay. Yep. 7 days a week. So 988 is what?
So 988 is the federal mental health emergency number. So like 911 is for physical, fire, ambulance, police response. 988 is for mental health emergencies. So 988 started in July of 2022. So we're about a year and a half into it. And Lancaster County is a call center for the state of Pennsylvania. So Pennsylvania has 12 call centers across the state. We cover 717 and 223 area codes and phone numbers that have a Lancaster or Lebanon exchange. So what happens when you call 988 is you would be prompted. You can select a Spanish speaking call center or the Veterans Hotline. And if you stay on the line, then you come to the call center that's affiliated with your area code. And from there, it's just like crisis.
Okay.
It's just like talking to somebody about what's going on. There's really no difference in the service. There's some stuff we have to do on our end that's specific to 988, but the experience for the caller isn't any different. The biggest challenge with 988 is that it does not have geolocation or geo-routing like 911 does. So if you're in Chicago and you're having a mental health crisis, and you have a phone number that's affiliated with Lancaster or Lebanon County, it's coming to our call center. So that is something that is really being pushed by call centers, that we need that geo-routing and geolocation, because we want people to get to the call center that can provide them the quickest and most accurate information. And if it is a mental health emergency and it is someone who's having suicidal thoughts and maybe a mobile outreach is appropriate, we want that team to get out there as quickly as they can so they can help to resolve the situation. And so that's probably our biggest challenge. But truly, the call experience is the exact same.
Okay. You started to talk about challenges. There
Yes.
are other challenges. What are some of those challenges? Kim.
And you can speak to the challenges you see, but from a consumer standpoint, when you're in crisis, mental health crisis, it's a very emotionally charged, well, any type of crisis, right?
Yeah, right.
Emotionally charged situation. So just, trying as much as you can to remain calm in those types of situations. Oftentimes, family members or, other individuals might call on behalf of someone. And so having as much information as you can have and really being an advocate for that individual. I think that's really, really important, is to make sure that you're advocating the professionals on the other end through 988 in crisis. They do this day in and day out. And so just really, working with them to ensure that you're providing accurate information so that they can select the proper level of intervention for the individual.
Yeah, staffing. What about
Staffing.
Yes.
So staffing across, really all of the mental health system, not just crisis, but certainly crisis, has been a significant struggle and challenge in the last several years, certainly since COVID.
Right.
The needs for services have gone up so much, and the staffing is not there yet. So sometimes you can't get the response that you want because you just don't have the staff to be able to do that, and that's across the entire nation. That's not unique to Lancaster or Pennsylvania, but certainly it's something that we experience.
Yeah, and I think there's less grace in mental health. So in systems like crisis intervention, when you go to a hospital, you understand, you can see physically that the staffing, there's a shortage on staff. And in mental health, the expectations are greater because, again, it's emotionally charged situation. And so, and there are a lot of, I think that folks aren't educated and they're not comfortable with a mental health crisis. So it creates even more anxiety. So I think, we invite folks to get involved in mental health. So there are a lot of entry-level positions in mental health still, especially with at BHDS, and especially in crisis and case management, and so lots of great opportunities for young folks to get involved in mental health, and we're really advocating in Lancaster County across the state to increase pay rates so that to align with the rates of physical health. So we're doing that in advocacy at MHA. We're advocating for that with our legislators, and just a lot of good stuff is happening in mental health. But we need to give mental health the respect that it deserves, because there are programs and services like crisis intervention, very high cost programming and services, and we just need to ensure and the staffing to ensure it's funded properly.
And this is why we're talking about this.
Yeah.
To keep the conversation going and to connect.
That's right.
Now, you're connected. Mental Health America is also connected here with Crisis Intervention. How do you work together?
So, first of all, MHA is a nonprofit, and it is not aligned with county services at all. So we are separate. But we work with crisis intervention. We work with other service providers in Lancaster County to get folks connected to care, to advocate for what they need too. So not only are we working with consumers and making sure that we're, identifying the gaps in services throughout Lancaster County, which I think MHA does really, really well. and we're able to partner and ensure partnerships that can meet those gaps. MHA doesn't need to do everything. But with crisis intervention, BHDS has been a great partner to MHA in that they are responsive to the needs. And I think, the Warm Line is an initiative that they, as an example of initiative, the peer support on their crisis intervention teams. Again, a response to identifying a need, and so we our advocates at MHA, our navigators and advocates, refer to the crisis intervention team.
And we refer to
all
them.
the time, all the time.
we
That
work
exchange.
together.
And
Work together.
so we'll work on behalf of a particular individual who might be struggling. So, I think working just hand in hand and communicating, finding out if they're involved in crisis, and if they're not, maybe they should be, or, or vice versa, right?
I mean, we
So-
certainly get calls that our referral and our recommendation is follow up with MHA. They'll help you advocate. They'll help
Yeah.
you connect to some support
That's
groups
good.
that they run, things
Right.
like that.
So briefly, in conclusion here, as community members, how do we support these services? Legislators.
We are calling for community members to help us advocate for more funding for services such as crisis intervention. 988 is not currently funded. It's only funded through
Only
grants.
funded through grants right now.
And through grants. And so, bringing more funds to mental health, and that's very important to understand, bringing more funds to mental health in Lancaster County helps provide really high acute services in Lancaster County.
Right.
So those that are struggling the most, it helps fund those programs, and any programs that insurance would not provide.
Okay.
So we're really advocating for that hard. I mean, we have our largest committee at MHA is our legislative committee, and it's a team of folks that are pushing for the best services that we can have in Lancaster County to support the mental health needs.
And I think what we've also pointed out today, too, is that there is help available. There
Yeah.
are resources. And by talking about this and letting everyone else know that we come in contact with, it's okay to talk about this. And here are ways that we can get resources. Here's where we can make a difference in our families and in our communities and for our overall well-being.
I think Rebecca said earlier that the demand for services has increased. I think we've done a really good job of educating
Yes,
individuals
yes.
and reducing stigma.
Yes, I think you have
Yeah.
it. Thank you both
Yep,
for being
thank
here
you.
because it is making a difference in our community. Thank you for joining us today on Mental Health Now. We can make a difference. Let's keep the conversation going.